Hello, my name is Pat Sullivan, Fire Chief, Harrison County Fire Rescue. I want to talk to you about the COVID-19 pandemic. Come back to you today after having spoke to you a couple of weeks ago, talking about our response, what we knew, what we didn't know about the COVID-19. Today, we know more than we did several weeks ago. We're starting to understand the dynamics of the COVID-19, how it is affecting people, how it's traveling across the United States, across our community, and we've done a number of things to address that. Number one, the threat of the COVID-19 is still with us. It is a serious type of virus. We do know that people have died from this virus. We know that the elderly and those that are compromised health-wise are the ones most at risk. Those are the things that we know. What we don't know is how long this is going to last. What we don't know is how do we keep each and every person from getting COVID-19. In the fire service, we are still responding to calls. We have altered somewhat our calls for the protection of our employees, for the protection of our first responders and their family, and of course for your protection, the public. When we go out to a call, we want you to know that we're taking every precaution that we can to make sure that we're not transmitting COVID-19 to other people. We're using protective clothing, we're using gloves, we're using masks, we're using eye protection. If we show up at your house dressed out in full protective gear, it could be frightening to some, thinking that it's serious, but remember this, it's for your protection and for our protection. We're actually going on the assumption that everybody has COVID-19, and if we treat every call that the person has COVID-19, then we know that we're protecting ourselves, we're protecting our family, and we're protecting the public. We practice social distancing in the fire service. We're reducing the number of firefighters that come together at any one time. We're reducing meetings. All of our meetings are being held by phone conference, by video conference. This morning we had a conference call with AMR, with all the fire chiefs. Just finished a conference call with all the department heads in Harrison County. Having another conference this afternoon with county, city officials. All of our conferences and all of this information that we're passing amongst one another is done by phone to reduce being together. We take that seriously. The other thing we take seriously is the cleaning of our fire stations. My recommendation is, once again, every 15 minutes you're cleaning something. Every time somebody comes in a fire station, we want it cleaned after they leave. Every time a firefighter goes out and comes back, we want to clean the fire station. We're asking that people do not come to the fire station unless they have a medical emergency, that they really need somebody, and then we're the closest thing to them. We ask that you call 911 and get an ambulance to come to you, to get the fire department to come to you, to get our medics, our paramedics on the road coming to you, and not come to the fire station and possibly contaminate the fire station. So those are some of the things we're doing that we've ramped up. We believe strongly that we can get through this, that it is a major disruption in our lives with the closing of businesses, the closing of the schools. All the closures is a very huge disruption. We get it, we understand it, and we're working with you, the public, to address the problems and the needs and try to make it easier on you as best we can. We're there to respond to emergencies. We're going to continue to respond to emergencies. We're going to take some actions that we wouldn't have done 4 weeks ago. There'll be times when the response may be slower because of the situation. There may be a response where we may stage and allow just one vehicle, one ambulance, one medic, one fire department paramedic to arrive on scene and assess the situation and go from there. So once again, now's not the time to panic. It was no time to panic in the past, and there's no time to panic in the future. The way we get through this is that we are sensible about it, we're intelligent about it, we're informed about it. Take the best practices and the responses from what we're learning from other fire departments, from the health department, from the CDC. We work closely with the EMA. we're having numerous discussions with our partners in other states. We're talking to Houston Fire Department is one of the fire departments that we have communications with, and all the policies that they're doing. Slidell is another place that we have communications with, and we're talking to their chiefs and how they're responding. We're talking to the state Office Fire Coordinator's office and getting the things we have in the state, information we get in the state being passed to us. We're taking all this information and we're sending it back out to our firefighters to keep them safe and safely respond to you.